Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. How are you? My name is Fellianti Muzdalifah. Currently, I would like to present my research entitled Spiritual Well-Being as the Predictor of Quality of Life Among Breast Cancer Patients in Indonesia. Beside me, the other members of this study were Mrs. Mira Aryani and Ms. Rahma Dianti Gajadinda. We are all from the Faculty of Educational Psychology in Universitas Negeri Jakarta. I'm going to explain this research, start from introduction until implication. The reason why we did this research because breast cancer is one of the most common cancer found in Indonesia with rising trends every year. For women, breast cancer is not only affected the physical appearances but also psychological condition. Breast cancer patients generally went through several treatments such as surgery, chemotherapy, radiation therapy, etc., which are stressful and exhausting. Cancer is often related to religiosity. Several people thought cancer is like a curse, but Indonesian is knowing having strong religiosity belief. Being diagnosed with cancer leads to psychological problem. For breast cancer patients, the change of physical appearances among women due to the cancers leads to stress and increase the risk of depression. Cancer treatment took long time and exhausting for patients. 3 dimensions of quality of life are general health, function, and symptoms. What about spiritual well-being in breast cancer patients? Cancer is like a mysterious disease because of no clear explanation how and why it happens. There is no guarantee that someone can fully recover from their cancer conditions. Several people believe being diagnosed with cancer is God's will, but others may blame God for their condition. Indonesia is well known as a country with strong religiosity belief, and it may affect how Indonesian people handle the psychological impact after being diagnosed with cancer. The purpose of this study was to explore the impact of spiritual well-being to breast cancer patients' quality of life in Indonesia. The sample was 102 participants. The instrument was a functional assessment of chronic illness therapy, PACIT SP12, is measured to spiritual well-being, and quality of life is measured by the European Organization for Research and Treatment of Cancer Quality of Life Questionnaire 430. The design was cross-sectional study, non-experiment, and quantitative methods. There were 2 variables. One is quality of life as outcome variable. Second was spiritual well-being as factors variable. Age, income, marriage status, stage cancer, cancer history in family are included as latent variable. The analysis, quality of life is measured separately for its dimension, general health, symptoms, and functions. The 3 multiple regression analysis are performed for its quality of life dimension. We got 3 findings. Finding 1, spiritual well-being affect quality of life in dimension general health significantly in breast cancer patients. The finding reflect 36.2% variances in quality of life dimension general health among breast cancer patients are affected by spiritual well-being and several latent variables. Quality of life function. Spiritual well-being affects quality of life in dimension function significantly in breast cancer patients. This finding reflects 25.6% variances in quality of life dimension function among breast cancer patients are affected by spiritual well-being and several latent variables. Spiritual well-being also affects quality of life in dimension symptoms significantly in breast cancer patients. This finding reflects 37.4% variances in quality of life dimension symptoms among breast cancer patients are affected by spiritual well-being and several latent variables. Conclusion: this study found a significant impact on spiritual well-being toward every dimension of quality of life among breast cancer patients in Indonesia. Implication: breast cancer patients might need an intervention which support their spiritual well-being after being diagnosed with cancer. That's all my presentation. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.